Schizophrenia is a complex and chronic mental health disorder characterized by a range of symptoms that significantly impact an individual's thoughts, emotions, and behavior. It often emerges in late adolescence or early adulthood and affects about 1% of the global population. The exact cause of schizophrenia is not fully understood, but it is believed to result from a combination of genetic, biological, environmental, and neurological factors. Understanding schizophrenia. 1. Positive symptoms. Schizophrenia symptoms are often categorized into positive, negative, and cognitive symptoms. Positive symptoms refer to the presence of abnormal behaviors or experiences that are not typically observed in the general population. Hallucinations. Individuals with schizophrenia may experience hallucinations, which involve perceiving things that are not present. Auditory hallucinations, such as hearing voices, are common, but visual hallucinations can also occur. Delusions. Delusions are false beliefs that are resistant to reason or contrary evidence. Common delusions in schizophrenia include paranoid delusions, believing others are plotting against them, and grandiose delusions, having an exaggerated sense of self-importance. Disorganized thinking. This symptom manifests as disjointed and illogical thought patterns. It can affect speech, making communication difficult to follow. Tangential thinking, loose associations, and incoherence are examples of disorganized thinking. Movement disorder. Individuals with schizophrenia may exhibit abnormal movements, such as agitated body movements or catatonia, where there is a lack of movement and response to external stimuli. 2. Negative symptoms. Negative symptoms involve a decrease or loss of normal functioning, affecting a person's ability to engage in daily activities and maintain relationships. Affective flattening. This refers to a reduction in the range and intensity of emotional expression. Individuals may appear emotionally detached or unresponsive. Anhedonia. Anhedonia is the inability to experience pleasure or interest in activities that were once enjoyable. This can lead to social withdrawal and a diminished quality of life. Avolition. Avolition is a lack of motivation to initiate and sustain purposeful activities. Individuals may struggle to complete tasks, attend to personal hygiene, or pursue goals. 3. Cognitive symptoms. Cognitive symptoms involve disruptions in memory, attention, and executive functions. Impaired memory. Short-term and working memory deficits are common in schizophrenia. This can impact the individual's ability to retain and recall information. Attention difficulties. Individuals may have difficulty concentrating and sustaining attention, making it challenging to focus on tasks or engage in meaningful conversations. Executive dysfunction. Executive functions, including decision-making, problem-solving, and planning, can be impaired in schizophrenia. This can hinder the individual's ability to navigate daily life effectively. Diagnosing schizophrenia. Diagnosing schizophrenia involves a comprehensive evaluation of the individual's symptoms, medical history, and a thorough psychiatric assessment. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, outlines specific criteria for diagnosing schizophrenia, including the duration and severity of symptoms. Subtypes of schizophrenia. Historically, schizophrenia was classified into subtypes based on predominant symptomatology. However, the DSM-5 has moved away from this classification in favor of a dimensional approach. Nevertheless, it's worth noting these subtypes. 1. Paranoid type. Characterized by prominent delusions and hallucinations, often with themes of persecution or grandiosity. 2. Disorganized type. Marked by disorganized thinking, speech, and behavior. Negative symptoms are prominent, and daily functioning is severely impaired. 3. Catatonic type. Features extreme motor disturbances, ranging from hyperactivity to immobility. Individuals may exhibit peculiar postures or repetitive movements. 4. Residual type. Individuals have a history of at least one episode of schizophrenia but are currently in a less symptomatic phase. Negative symptoms may persist. Treatment and management. Treatment for schizophrenia typically involves a combination of medication, psychosocial interventions, and support services. 1. Antipsychotic medications. Antipsychotic medications, such as typical, first-generation, and atypical, second-generation, antipsychotics, are commonly prescribed to manage symptoms. These medications help regulate neurotransmitters, especially dopamine, which is implicated in the development of schizophrenia. 2. Psychosocial interventions. Cognitive behavioral therapy, CBT. CBT can help individuals challenge and change distorted thought patterns and behaviors associated with schizophrenia. Supported employment and education programs. These programs aim to help individuals with schizophrenia integrate into the workforce or pursue educational opportunities. Family therapy. Involving families in the treatment process can improve communication, reduce stress, and enhance support networks. 3. Hospitalization. In acute phases of the illness, hospitalization may be necessary to ensure the safety and well-being of the individual. This allows for stabilization and adjustment of medications. 4. Community support services. Community-based services provide ongoing support, including case management, housing assistance, and social skills training. Challenges and stigma. Despite advances in understanding and treating schizophrenia, individuals with this disorder often face significant challenges. Stigma, misconceptions, and discrimination can contribute to social isolation and hinder access to appropriate care. Increasing public awareness and fostering empathy are crucial steps in addressing the stigma associated with schizophrenia. In conclusion, schizophrenia is a multifaceted mental health disorder that requires a comprehensive and individualized approach to treatment. Understanding the diverse symptoms, acknowledging the impact on individuals and their families, and promoting compassionate and informed communities are essential in addressing the complexities of schizophrenia. Ongoing research and advocacy efforts contribute to a more nuanced understanding of the disorder and improve strategies for diagnosis and intervention. Thanks for watching. Kindly subscribe to my YouTube channel and turn on the notification button so you'll be the first one to be notified every time I upload a new and educative video. Bye.